5:03, I call this meeting to order. Will the clerk please call the roll?
Jennifer Locke,
Present.
Charlene Murray, and Danielle Chenoweth.
Present. Okay. Is there a motion to approve the agenda? I second. Any discussion? Me neither. All right, all in favor? Aye. Okay, we have an agenda. We have minutes from the July 8th, 2026 monthly meeting. Is there a motion to approve?
So moved.
I second. Any discussion of the minutes? Have none either. All in favor? Aye.
Aye.
Next up, public participation. Anybody want to talk to us as a public member? No? All right, moving on.
Point of process, it looks like the Wi-Fi's not open anymore, so.
Oh,
I'm
yeah.
trying to get.
Got it.
For you, sorry.
Okay,
Sorry.
I'm trying to get to my packet, which is,
And I printed out the roll as well.
this is it.
The very-
Okay, I'm fine as long as I can get into it. It should be the public access or the Wi-Fi, okay, public.
While you are logging in, we'll ask if there's any correspondence from the administrator.
Yes, just want to give a quick update on the TB testing clinic review post. So we send out, we identify someone in Edison Middle School who had active TB and went through a process of identifying contact persons for that specific individual, and we sent out up to 100 letters. For the first day of the testing, we tested 11 people, 11 individuals, and for the second day we tested 12. And we got only one result that was positive, which really does not warrant any follow-up for the bigger group, or extend the testing site. So we refer that person for treatment, and then we also advise people to come seek testing at CUPHD if needed. So for West Nile virus, we had 11 trapped located throughout Champaign County, 5 in Champaign, 5 in Urbana, and 1 in Savoy. We have 4 who tested positive for West Nile virus. And for cyclosporus, so we have an outbreak going on nationally. So in our community, we have 4 cases for Champaign-Urbana, Vitusi, and for the Champaign County, excluding Vitusi, we have 3, a total of 7, and 2 of those cases are linked to recent international travel. So compared to other communities, we can say that we have very low cases, and we talk to the media about ways people can prevent more infections or cyclospora. But I also want to give an update on our environmental health. So our former environmental health director retired, Sarah Michael. She retired, and we went through a extensive process of hiring new ones. So we hired someone internally, Penny Murphy, and she has been coordinator for several years as a food program coordinator, and have an extensive experience in PH and leading other team members. So we are very confident in her skills, and she started yesterday. She started yesterday, so she will be attending this meeting. I just wanted to introduce her to the board, and if you have any questions, please reach out to me or her, she'll be able to assist. So I think that's all the update that I can think of right now.
No, we have any correspondence?
No, I just had a question about the retirement. Was Sarah eligible under the retirement buyout, or was she not here long enough?
She took advantage of the early retirement.
The early retirement. Is there a minimum number of years, do you know, that someone has to be present to be part of that?
20.
20,
20,
okay.
but Sarah
20 years,
was,
and you have to be 50.
Sarah was like 31 years.
she was 31 years with us, so she was an internal hire? Oh, it's just because sometimes I don't know who works at public health. Got it. I thought she was an external hire reviewer.
Okay.
Got it. That's all.
All right, moving on, old business, item number 1, discussion and approval of bylaws for CUPHD. Last month we talked about it, 2 months ago we talked about it. And I was hoping that we'd have a draft of ours now, and this is the third month in a row we've got the County Board of Health.
I was
Yeah.
confused because I was like,
Yeah.
this must be the wrong bylaws.
That's the template,
Oh, the
that we've been
template,
working off
yeah.
of, but there's much that's different,
Yeah.
so.
So I think the idea was to use the county board template, bylaws template, and then build on top of that. So I think essentially, since we was out, we didn't have time to work on that, but I think since she's here now, we will be able to.
Yeah,
So-
I think I don't think, it was my fault. And I should have reached out in looking at this agenda. So I was gone last month when you all discussed it. Probably what makes the most sense is for me to set up times to either talk by phone, Zoom, or in person with y'all before the next meeting and just go over sort of the things to change. And so I'll make sure you all have my cell so we can text and set up a time to do that. My kid goes off to college tomorrow, so I imagine I'll have nothing to do with my life. And so I'll be free to do that.
Did you want to were you talking about doing it one-on-one?
I think a one-on-one makes sense to meet with each of you, and then try to put those all together.
Okay. What would help me, because you've been with us long enough to know, is to take this template and make it, let's not discuss all the really
Sure.
obvious stuff.
Mhm.
So if you could take it and make it fit what you see us doing, just how, the structure, the number of officers, all of that is very, we should just do that. And then we should discuss about the more substantive aspects of the bylaws.
Yeah.
And if the other question is process one, which is if you're, we could discuss, one-on-one seems like a lot of time, and so we could either then look at it in the meeting, or if the concern is that it needs to be in closed session, I don't know if it would qualify for closed session.
Yeah, I'm not sure it would qualify for closed session. What might make the most sense or suggestion would be, since you all have experience on a lot of different, both public and I think private boards, is to say sort of on this, yeah, this stuff works the best on these boards, this thing doesn't. Number of meetings, whether someone can participate by Zoom, and if there's special reasons that have to be adopted for those, that sort of thing. And then sort of compile that, so here's the template, or here's the proposal, and here's some different ideas, either my ideas from looking at this, and here's ideas from other board members or members, or anyone else who would have suggestions, and sort of people can then at the next meeting discuss those and say, yeah, I think I like this better, or this hybrid idea.
So agreeing with Danielle that just having you, who's been here for so long, do a rough draft, then we address it, I think is the best way. We wouldn't be able to do a group meeting that isn't here because of Open Meeting Act, because there's only 3 of us on the board. We'd have to do individual meetings with
Yeah.
him, or else we'd be a
Or we
crowd.
could do a special meeting.
Yeah, or we could do a- but it
Which
would
is
have to
what a
be-
special meeting is meant for, is when
Yeah.
we want to go deep into a particular thing.
Yeah.
And I don't know if the bylaws will require or suggest like a deep dive of, we want to spend an hour on this, or if it's enough to review it, okay, here's some different ideas for this number of meetings, or for this issue, or for that issue, and then you can then we can all discuss it, you know, at the public meeting, come back, and then, then we'll just mock it up or clean it up for the final one. So that would be my suggestion, and I'll make sure to follow up then with y'all.
Okay. Great. I'm doing the governance document for CSPH right now, so I'm like deep, my head is deep in bylaws. And I have to say, I enjoy it, which is a weird thing to say, but it's true. I think bylaws matter, and I look forward to having some that work for us.
Yes, I was
Like,
surprised.
we should
you
be able to
had
have remote meetings, because we're a board of, like, remote call-ins, because we're a board of 3, I think it can be stressful sometimes. But I think there should be conditions on when people can use that, because in person is important.
Can I just add something really quick? I just wanna, again, thank Ruth for all the amazing work she has been doing for us. I think that with the schedule that we have, we meet every Wednesday at 5 and go through all the legal document that we have here at the CUPHD, and it has been a great privilege to work.
It feels really nice, yeah, just as far as clients go, like, okay, they're not months behind on something, or the client isn't, why didn't you do this? Well,
Yeah.
talk about it on Wednesday, so.
I really appreciate it, and we are on top of most of our staff, legal stuff, so thank you.
And the institutional knowledge is greatly appreciated, so it's good, it's good all around. All right, so we'll continue this to next month. Approval, item 2, approval of bid to A1 paving for CUPHD parking lot resealing and restripe. This is the one from last month where the low bid did not win, the high bid scored the most points, and we wanted to review it a little bit more.
We have our building manager here who can give an insight on that.
The reason it was so low, they were only going to do 1 coat, not 2. So we redid the coat, and it took it up to the same price as everybody else. A1 is actually $1,000 more than they were last year. And then I checked with county asphalt, and they were right at $1,000 again over last year. So really the prices are equal, and A1 is the lowest, and I would suggest that we go with them.
Is there a motion to approve the bid to A1 paving?
Can I ask the question first? So I was looking at the code sheet, and you're saying, maybe I'm wrong. So it looks like they're quite different in cost unless you're including the first bid, the original bid.
Correct, if you look at the first bid, they were like
Yeah,
several $1,000s.
23 versus 32,
Correct,
36.
and that was the reason because he was only using 1 coat of sealer,
Okay.
when he's supposed to be using 2 coats of sealer.
So you don't have a new bid list, but you now are saying that the low bid is now what amount? I mean, the bid that was the lowest, the 23,000 Elite Paving, what's their new bid?
I didn't bring him his 34.3.
Okay, versus an A,
A1.
yeah, so they only had points for cost initially,
Correct.
Elite Paving, but A1 has costs for being local and woman-owned and owned by a veteran or person with disability. Okay,
Yeah.
that's what I need to know. I would make a motion to approve A1 paving for, this particular project.
I have a second. Any further discussion?
Yeah, on that, I think we need to look at our grading sheet. It works for contracting as far as some type of construction and that type, but it does not work when we're looking at advertising or you're looking at some for IT, because you may end up spending a little bit more money, but we need to start figuring out a way to redo that so we identify what we're gonna get the biggest bang for our buck. I just don't think that process works for either one of those 2 areas.
on, please hang out and talk with us when we get to that. See no further discussion on this. All in favor of approving bid to A1 paving, say aye. Aye? Okay, and it is approved. New business, treasurer's report, May and June 2026.
Yeah, 2 months to report. First of May, they showed cash on hand at the end of May 31st at $6.6 million. Total fund balance of just over $8 million, which is 44% of the budget expenditures for the year. We ended the 11th fiscal month with a deficit of $486,708 against a budgeted deficit of almost $1.7 million. The total revenues 11 months through the year was $13.5 million, or $1.6 million under the year-to-date budget. Mostly it was made up of the property taxes being under budget by $249,600, grants and contracts under the year-to-date budget by $1.2 million, fee for service under their year-to-date budget by $236,000. Other revenue was over budget by $124,000. We had expenditures just over $14 million, or $2.8 million under their year-to-date budget. Personnel was under their year-to-date budget by $778,000. Fringe benefits under their year-to-date budget by $484,000. Contractual services under budget by $564,000, and patient care under their year-to-date budget by $266,000. So we'll flip to June, which is the year end, otherwise kind of the most important month out of the 12. Showed cash on hand at the end of June of $8,687,975. We had a total fund balance of $1.8 million, still at 44% of our expenditures for the year. We ended the fiscal year with a deficit of $408,374 against a budgeted deficit of $1.7 million. So we were 1.3 better than we had anticipated. Total revenues were just over $15 million, or $1.5 million under the year-to-date budget. Property taxes, again, under year-to-date budget by $255,000. Contracts and grants under budget by $1.1 million. Fee for service under budget by $271,000. Revenues over budget by $119,000. The expenditures ended up being $15,415,344, or $2.8 million under their year-to-date budget. Again, personnel under budget by $808,000, fringe benefits under budget by $506,000, contractual services under budget by $559,000, and patient care under budget by $201,000.
There are motions to place the treasurer's report on file.
So,
Second, all in favor? Aye. All right. Moving on, investment summary as of 6/30/26.
Sorry, I forgot to bring that paper, but I think it's down toward the bottom there, it says we got like 300 and something thousand in interest for the year, so that's really all I'm letting you know. Interest rates were a little bit lower this year.
Is there a motion to receive and place that on file?
so moved.
Second, all in favor? Aye. Next up, approval of CUPHD's 2027 tax levy. A, determination of the amount of money to be raised by taxation payable in calendar year 2027. Is there a motion?
I believe process-wise, we have to put this on file for 30 days. We're not passing it.
I believe
So
that's.
it's not an approval, but it's a motion to put the proposed 2027 tax levy on file. And I will make that motion.
I second. All in favor of placing it on file for 30 days? All right, that will be on file. We'll have it again next month. Next up, approval of Truth and Taxation Resolution 2026-08-01. Is there a motion?
Move approval.
I second approval. All in favor? Aye. Okay, moving on. Do this one, omnibus approval of payments to Board of Health appointees. A, Treasurer Ron Fields for July 2026 services, and B, Attorney Ruth Lyman for legal services 6/16/2026 to 7/15/2026. Is there a motion?
So moved.
I second. Any discussion? All in favor? Aye. Have that. Next up, review of monthly credit card statements. Is there a motion to receive and place on file?
So moved.
I second, any discussion?
Hold on just 1 sec, I'm trying to scroll
No,
quickly.
okay.
I don't think yeah.
Okay. All in favor?
Aye.
That passes. Next up, approval of check requests. Item A, D1 Networks Financial Year 2026-006 Refugee Center. Is there a motion?
So moved.
I second. Any discussion? All in favor? Aye. Okay. Next up, CS Construction Group for painting columns and basement. Is there a motion?
So moved.
I second. Any discussion of this one? Okay. All in favor? Aye.
Aye.
Next up, Public Health Accreditation Board for annual accreditation services fee. Is there a motion?
So moved.
I second. Any discussion? All in favor? Aye. Okay. Next up, our REIT advisors for incident response support. Is there a motion?
So moved.
I second. Is there any discussion?
I can
Yes.
just provide a few. So Arete is the company that after the cybersecurity incidents that our insurance company hired, and we have under our cybersecurity insurance policy, we have a premium of 25,000. So once we hit that, the traveler insurance company will pay the rest of the fee. So right now we are under that, so we want to pay that, and then after, I think we have one more invoice coming in, and then after that, we will be able to move forward with the insurance paying the rest of it, of the service.
So that, I'm guessing that's 25 deductible towards the technical, and then there's
Yes.
also a legal one later?
Yes,
And
yes,
that will be
exactly.
also 25 or?
No, it's just 120, 25 one time.
Okay, I was doing the math with the legal one later on, we're at 14,283 and then also 15,061, so that together comes to more than 25? So I'm just,
Yeah, and then, if the two are already included, so that means that after the 25, we won't be able to, we will not pay for any other invoice after this.
okay, well, what I'm looking at is we pay more than 25 already, so is that
Oh,
money?
really?
Well, if it's, for a REIT, it's 14,283 and 25 cents, and then for Mullen Coughlin LLC for incident response support is 15,061.
Okay.
So between those two, it's more than the 25, so I wasn't sure if it was 25 here and there, or if it's
No,
25 total.
I think it's 25 total.
Okay, so at some place the money will come
Yeah,
back.
so maybe, I'm thinking,
Our insurance
Yeah.
maybe have to pay us back.
Yeah,
some
yeah.
payment.
yeah.
If we-
But we are, what
Clarify
I'm trying
that.
to say is that we are in really great conversation with these folks. They've been taking good care of us. And at some point, I'm sure, because we need to pay that premium for them to start paying.
Yeah.
And there was two invoices. The first invoice is the technical one, and the second invoice, I don't know how they will make that payment difference to hit the 25 net. So that's probably my.
I used to work in insurance law a long time ago, and they don't want to, but they will. It'll all get
Yeah.
straightened out, but on the back end, if we're a nag about, hey, we paid 30 grand now of our
Maybe
25.
I can reach out. I am the
Yeah.
one who's really in contact with
Yeah.
insurance agents, so I can let
Yeah,
you
because
know
right now
that.
it's over $29,000, so that's 4 over already, so
Okay.
hopefully. All right. But with that said, they provided the service to us, the 14 is less than that 25, so, have we gotten a motion and a second on this one already?
Yes, you have.
We have, okay, great. Any further discussion? Okay, all in favor?
Aye.
Okay, and that one goes on. Next up, City of Champaign Finance Department for 2026 Black Mental Health and Wellness Conference Sponsorship Contribution. Is there a motion?
So moved.
A second. Any discussion?
Yeah,
and
Yes.
and township will be tabling. My
Okay.
question is, the $5,000, which was sent as an invoice,
Mhm.
what, like, what other co-sponsor, like, there isn't a website on it, there's only a registration, so who else is co-sponsoring? What are their amounts, like, you know?
Yeah, so
Are we branded as, you know, a sponsor in it, cause I
Yeah.
didn't see that in the documentation,
Yeah.
so like,
yeah, I
it's
should have
important.
sent you the letter that they sent me. So there is a letter that they sent requesting 5,000.
Yeah, well, there is one here
Oh,
that
there's a
is
letter
from
attached?
Tracy.
Yes, yes,
And he's
okay.
like, we're seeking a sponsorship of 5,000 to cover
Okay.
the cost of the conference.
Perfect.
Here's how many people we're expecting, but it doesn't say, and you'll be listed as sponsor, or, you know, it doesn't say you will be one of 10 sponsors.
I would defer that to Makaya since
Yeah.
she's part of the organization committee.
So we'll be one of the sponsors and we will be listed on the program, brand program, and then any infomercials that go out with the organizational event.
Okay, so we will be,
Yes.
it just wasn't clear from the letter.
Correct,
You know.
sorry about that.
No, it's fine.
And there is about 15, I would say, sponsors, City Champaign, Carl Hospital, just a number of
Okay.
individuals in the community who
Good.
annually sponsor for the event. Smaller amounts or larger amounts, all across the board, so I think we donated, I think, 2,000 last year, or 3,000
Yeah,
last year.
I wanted to jump on it and see that last year, I think when it happened, I was already here. I think we sponsored, I believe, 3,000.
Okay.
So,
Cool. It's helpful just to know, because there just wasn't information about like, are there others and what does it look like,
Yeah.
and making sure, cause public health, it's a sizable contribution, and it's important that
yeah,
we're
no,
acknowledging.
you're exactly right.
That's all.
Yeah,
Yeah.
and then I have to say, I have attended last year,
Mhm.
event, and it's a really well attended event.
Yeah, it was packed.
Yeah.
It's been, I think
Yeah.
this is the fourth year?
Yes.
Fourth
Yes,
year,
yeah.
and I think we've attended all of them, and it's been very well attended
Yeah,
and a
it
really
was.
critical
Yeah.
conversation,
Mhm.
so. I think I moved and you
And
seconded.
I did, so seeing no further discussion, all in favor?
Aye.
Aye. All right, we have 5, great, let's go. Next up, Mullen Kaufman LLC for incident response support. I'm assuming this is our lawyer bill.
Yes.
Is there a motion?
So moved.
I second. Any further discussion on this one after earlier?
Dang, it's expensive.
It is. So I would just,
It's
ask,
fine.
right, I would just ask that we contact the insurance to
Yeah,
find out.
I will definitely do that. I will follow
Yeah.
up on the next one.
That's
Trust me, I will do
No,
that.
yeah.
The other things that I wanted to say is that if you look at their invoice, it's very detailed.
It is very
You know,
Yeah.
and I
$325 an hour, and then it's like, you know, it's
Yeah.
like 1/10 of an hour,
I know.
1/10.
One of the most infuriating things of that bill is seeing that we're paying this expert to talk to that expert. Our lawyer is talking to our technical advisor, and we're paying on both ends.
I know.
But that's how it works.
I
So
know.
it's fine,
I
it's
know.
good,
I know.
it's why we have insurance.
Yeah.
All right, I learned something here. With no further discussion, all in favor?
Aye.
Aye. All right. Next up, ratification for check requests. We can do these separately. Sola Gradia Farm for sub-grantee, Illinois Healthy Resilient Communities. Is there a motion?
So moved.
I second. All in favor?
Aye.
And then next up, Douglas County Health Department for Illinois Tobacco-Free Communities, DCHD grant, or DCHD June of 2026. Is there a motion?
So moved.
I second. All in favor? Aye. Okay. Next up, approval of requisition payable to North American Syringe Exchange Network for Easy Touch Insulin Syringe. Is there a
So
motion?
moved.
I second. Any discussion? Okay. All in favor? Aye. Okay. Next up, approval of bid for website cloud backup services. Is there a motion?
So moved.
I second. Any discussion of this one? Okay, I'm just looking at a note here, like we have a low bid with a high score, which is the way we like it to be. So, all in favor?
Aye.
Aye. Okay. Next up, approval of financial year 27 professional service agreement for a community network anchor between CUPHD and Family First Advocacy. Is there a motion?
So moved.
discussion of this one?
Just wanted to understand it. What's it about?
Oh, community network anchor?
Yeah, definitely.
Yes, is Rob here? Yes, can you give a quick summary?
Yeah, so
of
the
the-
Community Network Anchor Project is a project that's funded by IUPH. The mission of that project really is to invest in local communities and parent leadership to improve access to mental health services. And we do that through education, collaboration, and information. This partnership with Family First Advocacy is a partnership that was really encouraged by IDPH. And we're leveraging that partnership and investing in parent leadership. So making sure that we have lived experts at the table, we're listening to them to gather information about issues that they're experiencing in the school system or across systems, and just trying to bridge some of those gaps and make connections and kind of address the youth mental and behavioral health crisis that we're seeing in Illinois.
And I would just add that as part of our health priority, this aligned really well with when we applied for this grant. We were able to secure this grant because they pick a few, one agency by region, and the Champaign region, we were able to secure it, mainly because one of our health priority isn't aligned with this grant, and really we are trying to build a consortium of service providers for mental health that can convey and provide feedback, but also having lived experience, people with lived experience. And this organization is really good at bringing people with lived experience, especially family with children with mental health problem or issues to the table and provide input. And I think as part of the grant, we decided in collaboration with IDPA to be able to pay those family members who bring their kids to these discussions to be able to pay for their time during the meetings and their mileage also to come to the meetings.
Any further questions?
So I think what I don't know, Family First Advocacy, which raised a red flag, because I know every organization in the county.
Yes.
So, so I was like, who's this and what do they do? And I was starting to look at it and say, it's very interesting. They're based in Muhammad,
Yes.
and I just, in thinking about us as a public health district that primarily focuses on the metro area of Champaign-Urbana, I think my concern was making sure that we're investing. There's no question about, I just don't know them, positive or negative, but making sure that they're connecting to organizations in the county
Yes.
and that they are serving Champaign-Urbana. Because I run a program with families who are experiencing homelessness where their children have a lot of difficulty, mental health and others, and I've never had any contact with them. I haven't seen them at any of our outreach events. We are tabling at all outreach events, so I just have a pause of did they bring the grant to us?
Yeah.
And they gave to
No,
us?
they didn't.
Okay.
So when we secured this grant, IDPH was already working with organization on the ground, and this was an organization that they recommend
Okay.
to be working with.
It's a fairly young organization, and I will say that it is a regional project. So, we're trying to make connections throughout the 15 or 16 county region.
I see, so the funding is for a 16 county region, we are the host of that.
We're the anchor.
Yeah.
We're the anchor, and then we're funding this particular organization.
Yeah.
And I guess I don't know that many organizations that do this. I'm really excited to know they exist because it's a missing gap. So I'm wondering, but I wonder in a 16 county region if there was a competitive process, because we are a public entity.
Yeah.
If there was a competitive process for organizations to apply.
So as far as I know, they're the only family-run organization I know that Family First Advocacy also had an arrangement with Rosecrans, working on the Pathways program, to kind of offer parent peer support. So I know that they've kind of built a network with people who have lived experience, and that's really what we're trying to get out of this partnership with them, is including family and youth voice at the table.
Including family and youth voice at the table
To address the system issues with respect to mental health.
So are they part of a strategic planning process, or are they more, like,
That's the goal, to identify strategic priorities.
Okay.
The plan is also to come up or create an advisory panel that includes parents as well.
Great. I would just say, think about those working with families experiencing homelessness as an important constituency that often gets lost
Yeah.
in the mix. So
Yeah.
I'm happy to help connect in that regard. There's a lot of need in this area.
Yeah, I remember when we applied for a grant, we secured the grant, they already have, IUPH did, they already have identified family-run organizations in the region that we could potentially go, and they suggested
I do.
this organization.
Okay.
And we before, we were like you, we're very skeptical, we invite the person, Rob and I did, and sit down with her and talk, and do some type of interview, and we signed an MOU, and the MOU came here with the board for approval before we went with them. And so far, I haven't heard any complaint in terms of, running the meetings and bringing people with lived experience in the meetings.
Yeah.
But
This will actually be our second contract with them.
Okay.
This will be our second.
contract.
Okay.
Yeah.
I guess I missed it the first time. It's
Yeah.
one of those things. Yeah, I mean, I would say helping to connect them with the Black Mental Health Wellness Conference that we just funded, and making sure, it will be important, and, helping them to connect to organizations within Champaign-Urbana. That would be important too, and particularly making sure that they're, supporting folks of color in that process.
All right, so no further discussion? Okay, seeing no further discussion, all in favor? Aye. Okay. Next up, a discussion and approval of updates to 9200-07-01 CUPHD purchasing policy rules, regulations, and procedures for purchasing. So this came to us last month when we didn't like the way our system could be gamed, I think. So, let's see, print out the rules.
You printed it here.
So I guess first we'll start with our esteemed colleague who has thoughts. What our boots on the ground, what are we,
Well,
what are
I mean,
the
I
big
don't know.
concerns we have?
I just bring it up that I think we need to do a lot of research about this so that we can move forward with future projects, and also even look at the ones that are for myself, like contracting, to refurbish something. There's gotta be a way that we don't lose what we're gaining as far as local area, local people and minorities and such. But at the same time, give opportunity to maybe a firm that keeps on missing out. We're starting to find that a lot of these contractors are not responding anymore, because each time they do, they put a bid out. Yes, they might be a little lower, but if you look at the overall score, they're getting blown out of the water because, yes, they're not local, or they're not using union, and may not fall underneath the minority arena, but so that makes it tougher to get that 3 bid needed. I mean, do we just take it down to 2 bids, what we gotta do? I mean, we're running out of companies that are willing to come in and give something because they know what's the bottom line, they're not gonna get it.
I would,
Because they keep on getting turned down over and over.
I would add also that, this area, there are companies that will not drive and come and look at the, whatever we ask them to do with it, from Chicago. And locally, probably we have 2 companies who can do that, or 1 company who can do that. So it just, it's a little bit restrictive, so to speak, on that end. But I also will say that the criteria sheet is really good when applied to construction bids and other type of bid that it's appropriate. And I've seen those in play. But again, just to make sure that for advertisement, contracts, it's difficult to get. For example, elevators, servicing elevator, there's only one. I mean, like if you ask some other company from Chicago to come do it, they won't even reply, or they have to charge you. I think the one company that we asked, they have to charge us almost $900 to come and just give us a bid. So those are the restrictions that we're running to. We can look at it broadly and come up with the solutions, or have criteria that adapted to people's unique situation. But overall, I'm really satisfied with the criteria sheet. It really minimized discussions, because anything that goes through the criteria sheet, if it's 3 bid and it goes through the criteria sheet, there's no discussion about which one is best. But there are unique circumstances where we're running into that it's very hard. Sometimes we're one code and we get into another code, and we are not able to bring it to the board. So I think we run into the issue also about the radio, emergency radio, satellite radio. So we had 2 bid, we needed to have 3 bid, and it takes longer for those company outside, out of state to give us a bid. And by then, the 2 bid guys, expired. So we have to reach back again and update it. So those are some unique circumstances that we have. But overall, I think the criteria sheet, or the criteria, is really good when applicable to the item that was built for. But it's not applicable to all. Like there are some unique circumstances.
I think one way around it is use the criteria sheet, but if you come into something where you can only get 2 bids, or if you come into a situation, say for advertising, that really the best bid out there is going to be the most expensive bid. If we have just a justification letter, a very good one, saying, the reason I want to go with these people for my advertising is, I can get this many billboards, and I can get this many on buses, and I can get this compared to what the other ones can provide, and you can show that the bigger bang for your buck is over here. And the same way as, like we were talking about the elevator. I've got 2 good quotes. I've got a 3rd one, they're gonna work on it, but I got a 4th one that wants to get payment down before you show up. So we might be able to use just the criteria and the grading sheet the way we have it, but maybe we can attach something to that that will show justification why we want to go a different way. And have something that, stating in our policy that if a situation like that comes up, that we can no longer attach a certain form, that we can move away from a little bit.
So in reading through the, as it's written, I only see one thing that might need to be changed. So the document says that, it says it's not that the lowest bid always wins, it says greater consideration shall be given, and then it says may, so there's a number of may terms, and I remember us working through this for that reason. The second thing is it says due diligence, it will be done to obtain a minimum of 3 votes, so it says due diligence in the proposal, which basically, what I would do is, the thing that I think it doesn't bar us from doing, and if you want us to add it explicitly for future staff, we could do this, which is to say staff are welcome to provide an explanation, or you call it justification letter, with their input. The reason I did only one quote is because there's only one elevator company and the rest are asking $1,000, or, this is only allowed, and I think we talked when we created this about that circumstance, it does come up. And so I think we would welcome staff explanation or, justification letter for your input. I think the piece that is not persuasive to me is I'm the slightly lower bidder, but I keep not getting any because I'm not, I don't fit.
Union, not local.
I'm not local, I'm not union, I'm not disability or veteran, I'm not, I guess I wanna say that having done grants in this arena, where when we were a granting agency for many years, and I started asking demographic information, and the rage that I experienced from nonprofits, some of whom just flatly refused to give demographic information, and were very flustered and upset, and even like boycotted the grant process, and I was like, good riddance.
Right,
And that is my opinion in that case as well.
No, that's what I'm saying, but long as you have a justification letter, that the reason I've only got 2 bids is other ones do not want to supply a bid any longer because they've not received the contract. As long as I can put that justification in there and say that's why
Yeah,
2.
we
I'm
attempted,
good with
but
that.
these have
Right.
not, here are the ones that did not giving us a bid.
Another thing that I would add though is that with the scoring sheet, if we, I think the concern that we discussed, I discussed with Jim, is that if we don't change the current policy and add the language, and then we just put that justifications in the bidding and then send it, they can come back to us and bring raw story.
Yeah,
that,
and legal review, I think would be
Yeah.
important.
So
I
that's-
do
that's
think
the
it
concern.
says the board is making that the board's making the decision.
Yeah.
There's a lot of
Not
nays,
this stuff.
not a lot of
And
shalls.
there's a lot of greater
Yeah.
consideration in May, so, and Ruth, were you here when we did this, or was it after your time?
I sent it to you.
Yeah, I think so.
You were, so I mean, I think another look to just make sure that, we are allowed to, consider staff input, in looking at that, that situation.
But I do understand your point about the bidding sheet, maybe giving a false impression that if you game it, that's what you get. So we might want to do something to outwardly tell them ultimately
Exactly.
the board's
Is
determination is
it-
it.
Yeah,
Something on the
yeah,
bottom.
yeah, something on the
It's
bottom or in the top.
instructive, the
Exactly.
scoring sheet is purely instructive to the board,
Exactly.
but it is not a guarantee that
That
the
you
low
get-
bid or the
Which
high,
may
the high
actually
score,
help.
yeah.
Because we
Because we
understand that, right, but it's
Yeah.
no.
But
it's not
making it
writing.
clearly in
Yeah.
writing
You can
for
also
potential
communicate
bidders.
to them that, it hasn't always been the highest score bidder. We've taken into consideration past performance.
Mm-hmm.
We've taken into consideration, speed,
Mhm.
Yeah, if they
whether or
have
not they're
knowledge
close
of
by.
us.
Mhm.
These are other things, I mean, multiple times it's been very close and we've chosen one over the other. Usually we'll choose the one with the highest points, but that would be helpful. I also wanted to ask, because I know this is a can of worms, but I'm gonna ask it anyway.
Yeah.
So Champaign does this and they have a whole rigorous process
Process,
of approving. And in this case, we're basically allowing people to just self-report, correct? Or is there a?
Like, you mean like
Do we
contractors?
verify?
If they're a
if they're-
minority
oh,
owned
no.
Yes, we-
business, can we,
At least from construction side, and if you, since I have been here, people who went through the process, we would make sure
Okay.
that they.
Are
they-
minority owned
Yeah,
or female
yeah,
owned?
if they have a website, we'll probably go and look at it, but
It
really.
seems like the minimum because I've seen some scams around
I know.
this issue, so.
I know, and I wanna also say that I am open to, that's why I don't want this process to go away, because it,
Yeah.
it really is safeguard for us. But we just wanna make sure that it's a consistent process, that if the writing is not on top, like you were mentioning, that's my worry. They can come back and say, based on what criteria did you give, so if it's saying clearly in red on the
Yes.
criteria sheet that,
Yes, on the-
you know, the determination, the final
Will be determined by the board,
by
yeah.
the board, that the scoring sheet is just instruct, to make it clear. So I would be.
The contractors don't see the scoring sheet, but they do see the criteria sheet.
They see,
And
yeah,
that's where we really should put that.
the
Yeah,
evaluation.
that's what,
Yeah.
that's what I would.
That's
Yeah.
where we should put that.
Yeah,
So
and
they
you
can
should
see
put
that
that.
right off the bat, that, this is.
Yeah.
I mean, I think you can put the final decision be made by the board, and as per, ordinance blah, greater consideration may, you just put the language of.
So
Then
we
It
it
really
really
stresses the may, not,
Yeah.
not
Yeah,
will,
I
not
know.
shall,
So
may.
we will, or should I
Take
say
a
may
crack
I?
at it.
So, we'll add that and then send it to you for review, and then
Yeah.
bring it to the board, like
Yeah.
those updated,
Yeah.
to the next meetings.
I have a quick question. Actually, a question of clarification, and then also just a little bit of IT perspective. We talked about a couple of agenda items ago, the cloud backup services, and I just wanted to make sure I understood. My recommendation was a company called ThinkGuard, which had the lowest score with the highest bid.
Oh, yeah, yeah.
Okay, I just wanted to make sure, because I think
Yeah,
your comment
I
was.
I misspoke my note.
Okay, okay.
Yeah, we approved your request.
Okay.
I misspoke.
Okay, I just,
I'll tell that to the camera.
I'm very sorry.
No, you're good, right, thank you.
And I think Jim and Mamadou have already spoken to this, but from my experience in this process, we're not going to find a lot of the things that are on the score sheet in like a nationwide search for a tech company that can meet specific needs for us. And so for that reason, I understand that there's probably a good reason to have that scoring sheet. But I don't know exactly how this would be done, but I think for talked about advertising and tech, and there are probably some other instances where that specific scoring sheet might not benefit us as an organization in being able to go out and secure a relationship, the best relationship we can with the most appropriate vendor. And again, I don't know exactly what that looks like, but I can say, like, from my experience, my perspective is that it was challenging to find the appropriate vendor for our cloud backup services.
We want, I believe as an organization, we want everyone to apply, right? But we also want what's best for the organization. So yeah, we might have to consider that it's not a one-size-fits-all. So that might be something that as we're taking a crack at changing these things, maybe we have a different sheet, or maybe we don't have a sheet. We just say, hey, if you've got any of these special things, let us know, and that will factor into the decision making.
I would say though, the benefit of the sheet is, there is a benefit in the sheet and the criteria sheet, and I know that for constructions, like there are specific things, I don't know all of those things on top of my head, but there are specific work related stuff that it's very good. I mean, like, we won't have this discussion if we go through it. I just wanna make sure that we have still the criteria sheet, but give flexibility, or add an addendum, to the criteria sheet saying that, if this, specific, sectors that we can find more, like, just put some language there that, staff don't get overwhelmed when they look at the criteria sheet. I don't know if that makes sense, but
So, having worked in tech for a long time and run a tech company, and having been the person who was writing many of the proposals in response to public bids, I think for tech, what makes the most sense is, like, you're almost never comparing apples and oranges, apples and apples, I mean. So like tech is always like, everyone has like a different approach, kind of a custom approach to things. So there's a set of things that you need, and then you'll get various levels of like, some folks won't give you everything you need, or they'll give you a part of what you need, or they'll give you more than what you need that you didn't know you needed until they proposed it to you.
Yes.
And then you're like, actually, that would be really great, which I kind of, when reading the what is it, ThinkSoft?
ThinkGuard.
ThinkGuard, ThinkSoft, let's think softly. ThinkGuard, that, it was more like that situation, so I wonder if even like a matrix, I mean, you know, we probably are doing this anyway, which is like, here's the things we need, these are the 3 bidders, check box which ones do what they do, and if they do more than that, you would say like, these are the extra things that they do, to also help you like kind of evaluate
Yeah.
that. And so, I don't know, maybe that one of the things that is missing from this is like fit with the scope, like this, you know, like,
You mean
and
the
I thought it was
criteria
really,
sheet?
yeah,
Yeah.
like with the criteria sheet is kind of like, how well does, it's almost as important as price. Like price gets 10 points, and it may be like scope fit, or like fit with our scope, and needs is another piece. And there are some things where you're buying syringes where it's like scope fit, who cares? But there's other things like IT where scope fit is really an important part of it. I found that the way it was done here was convincing, it made sense, like you gave a lot. What was missing was like, what's wrong with GFI? You just happened to have proposed the other person at the time when GFI hasn't come and fixed our
Yes.
printer
Yes.
in 2 weeks,
Yeah, I know.
like 3 weeks.
Yeah.
They used to be great, so I don't know if they're under new management, but really bad situation, can't do anything. So I was like, I'm not gonna argue about what did GFI not give you.
Yeah.
But it does help, it would know like, okay, we're getting this from ThinkGuard, and GFI does not have any of those things. But I mean,
So maybe you want to, keeping the sheet as is, we add another, and at least in tech, we add another where it's like.
scope fit.
Scope fit, or staff, like the staff can just assign like up to however many points for like, this is the one that makes the most sense to us, and then they can justify it to us here.
Well, it's true, it could be built into the point system. Yeah, I mean, and you could be, the staff would be looking at, experience working with us, this fit in terms of the scope, et cetera. And we could look at that, and we may, but we might override you because
Yeah.
it's our decision. So it could be, if we give five points to the staff,
Yeah.
we might say, well, but this is more important in this arena, or we could have a discussion about it. But I understand that tech is a little bit different in the
And
some
the
thoughts.
example that you give to tech was the same example applicable to advertising. What we asked, they provide more.
Yeah.
What we didn't ask,
Yeah.
is we didn't know what to choose, and the criteria didn't give it.
Yeah. Yeah, tech is changing so much, sometimes you don't know what's possible until you have a conversation with the vendor. And also they'll sell you lots of BS sometimes. But they're true.
So for
Thank
this one, we are going to push the work off onto y'all, and you'll bring it back to us.
Yeah, we'll
With-
try to work
with-
on
with
the
some maybes
criteria
and
sheets,
some-
add language about the board has the final say, and the scoring sheet is just instructional,
Yeah.
all of that. And then I'll send it to you for review before I present to the board.
Great. Next up, we have pending grant contracts for the administrator to sign. Are there any this month?
There are none.
There are none? Great. Next monthly meeting is September 9th at 5 p.m. and this meeting is adjourned at 6:02. We did it in 59 minutes. Yay. And yeah, didn't play one right here because I brought it several months in a row and did nothing. So I